Hey everyone, it's Pal here. Just doing a quick transition update video. I haven't done one in a long time, and I think it's time for one. I just recently came back from Dr. Satterwhite's office over in Green Bay, California, where I had my second top surgical procedure. I had an nipple and areola reconstruction surgery, and the first surgery procedure I had was back in December of 2014, and it was a keyhole incision. And I knew then that if I went that route, that the odds of me having to do another procedure, like a revision procedure, were high, just because of the size of my areolas and my nipples. And according to Dr. Satterwhite, that's really common with a lot of folks who choose the keyhole route versus the double incision route. And the reason I chose the keyhole route was because I wanted minimal scarring. With the double incision procedure, I would have had more scarring, which is where you get the scars right under, and they open and they go under to remove the fat tissue, versus the keyhole where they do a simple incision and they pretty much they suck it out and remove the fat tissue. So now what I had done with this revision, they just resized my areolas and my nipples to make them smaller, more masculine looking, and they also did some chest liposuction on the sides to remove some of the fat that was left over on the sides and up in this area. So I'm a little bruised up still. In my Instagram, I posted an image of my chest. I would show you now, but it's kind of hard to take the shirt off without help, and I'm by myself right now, so that's gonna have to wait for some other time. This shirt, actually, I'm really thankful that I get to wear a compression shirt versus having to wear the binder that they originally gave me. I thought I would have to wear that for like 2 or 3 more weeks. That was like hell for me, like wearing that binder and the bandages. Like this past week after my surgery was just so uncomfortable, really itchy. I was starting to develop a rash, and it was just, I couldn't sleep. It was bad. But I'm really thankful that when I went to the doctor, they took it off, and he's like, oh, you're healing well, you don't have to wear it. I just want you to wear like something to compress it. So he said that wearing this shirt is fine, which is great. And I'm still oozing a little bit, but that's normal, he said. It should dry up within the next couple days. And the best thing of all is that I can finally shower. Like, oh my god, I haven't been able to shower, or I've been able to clean myself, but not like take a full-on shower. So I've been using baby wipes and whatnot. So being able to get in the shower is just, it's just the little things, that you take for granted, and it's not until you can't do them that you realize just how awesome they are. So that's something I'm looking forward to, being able to shower. And although I can't have the water hit me directly quite yet for another 2 weeks or so, and I have to make sure that when I dry myself, I pat myself down. Also, I have to keep wearing this compression shirt for like another month or so, just keeping the areas tight, nice and tight. Other than that, I'm feeling good. Just a little sore. Can't really walk too fast, so I'm walking really slow. But I'm eating normally again. Although I can't really eat spicy food, it doesn't do me so well, which is kind of a bummer because I love spicy food. So I'm trying to, ease up on the salsa. So I can't be putting salsa on everything. at the moment. I'm eating better, mostly liquids, but I can eat solids again now, which is great. What else? My energy's coming back. That's another plus, and I'm looking forward to sleeping tonight without that binder. Hopefully I can get a good night's rest. It's been good having this week off from work. It's been really stressful. So in a way, yeah, I'm recovering, and it's been kind of painful at times. I'm kind of thankful that I don't have to be at work and that my work allows me to be here to do this and take the time that I need to recover and whatnot, and to do what I need to do. So I'm really thankful for that, and I'm thankful to have my partner and my family who are really supportive. And my sister actually took time to be here during my surgery. She took time from work, and my partner took time to be there with me today during my reveal. So, I'm just like really, really lucky and fortunate, because I know a lot of folks who are in my situation don't have the same amount of support, that I have at this time. And I'm just really blessed. I'm really blessed, and I'm really thankful for that. And this time around, for my second procedure, my first procedure was fully covered by insurance, but this time around, and I wish they would have told me this a long time ago, because just the last couple months have been really stressful, because I'm getting married in October, and just planning a wedding, and then just living expenses here in San Francisco are crazy. And then at the very last minute, they're like, oh, by the way, you're gonna have to pay like $2,000 out of pocket. I'm like, what? And I appealed it, and unfortunately I didn't win, and so yeah, I ended up paying like $2,000 out of pocket, because my insurance didn't cover all of the fees. It covered a huge chunk, which I'm grateful for, or else I would have had to pay way, way, way more. But $2,000, it's still a lot, at least for me. I'm not rich or anything, so but I'm really grateful and unfortunate to be able to have these opportunities. I know a lot of people are still waiting to get where I'm at. So, I just keep reminding myself that this too shall pass, and that, tomorrow will be a better day, and the bruising is temporary, and, the swelling as well, and that sooner or later, and my chest is going to look exactly how I want it, and so I'm okay, So that's a quick update as how I'm doing and how my surgery went. The surgery part itself wasn't the scary part. It's mostly, or I wouldn't say scary, like tedious part. It's mostly the recovery process, like afterwards, like taking care of it, and and taking care of yourself. That's the hard part. Not so much the surgery. The first time around, I was really nervous and scared, because I've never been put under completely and had anything really major done on me. So, but after the first time, this time around, it was just like, all right, give me the anesthesia, put me to sleep, let's do this. I didn't feel anything. And the staff over at the Greenbrae Surgery Center, they were just amazing. I love my surgeon. Dr. Satterwhite's great. They know what they're doing, and they make you feel really comfortable and welcome. And just, I'm really thankful to them as well for taking good care of me. So it's not until after the surgery that's when you're like, oh, it's painful, it hurts. But that also passes, and once in the long run, that's the long-term results are really what you what makes all of this worth it. So I'm looking forward to getting to that point. And I'm glad that I was able to do this before my wedding in October, because I wanted to feel really comfortable in my own skin when I'm walking down the aisle, when I say I do. So I'm glad that I was able to do this before that time, and that I'm gonna feel really comfortable when I go and get my tuxedo tailored and everything. Just going through this process, it's made me feel more confident, just more sure of myself, and just having that confidence level, it's amazing, and I feel like I can do anything, and that with all this, there's some transitioning and passing as male. You inherit a lot of the male privileges, and that is another video that I will do in another time. What does it mean to pass? What are these privileges that you inherit with transitioning? The differences between trans men and trans women, and especially when it comes to privileges in the workspace. So I'll talk a lot about that, because I work in an all women's shelter, homeless shelter, and the majority of my clients are transgender women of color, and most of them are HIV